I've been speaking to Dr. Hans Kluge, the WHO's Regional Director for Europe.
First and foremost, it's amazing that the Ukrainian health system is still standing. It has been very, very resilient and what I call agile to adapt almost on a daily basis, be it by putting solar panels and generators so that hospitals, maternity wards still can function despite on the attacks on civil energy infrastructure, be it by mobile mental health teams or digital technologies to provide medical service to the front line. But we should realize that this is very fragile.
So we're now 2 years into this war. Who is most at risk and what kind of help do they need?
There is a bit of a shift now. At the beginning, the focus was on the immediate response, the life-saving interventions, trauma kits, surgery, which is still necessary, but there is now a shift under the guidance of the Ministry of Health and WHO towards what we call chronic diseases, cardiovascular, diabetes, cancer, lung diseases, because 8 out of 10 Ukrainian people who die are due to these chronic diseases. So this has huge implications also on the health system, the procurement and supply chains. So now there's a bit of a shift from acute response to reform and recovery through a very strong primary health care and also, very important, the gender-based violence. A lot of girls, women are prone to, be it violence at home or due to the conflict situation.
So you've been quite positive about the state of the Ukrainian health system. Clearly, though, it's not what it was. What will it take, do you think, to help Ukraine recover?
Well, it's amazing. Always when I go to Ukraine, I make it a point to go to the front line to encourage the doctors, the nurses, some of them who have not been home for 2 years. It's amazing. But what is needed is a very strong budget support from the West, from the global South, from other countries to continue at least the salaries and the basic medicines for the health system.
And we know, sadly, that Ukraine is, of course, not the only crisis going on in the world. How hard do you find it to keep that global focus on what's happening in Ukraine?
Indeed, there are about 14 what we call grade 3 emergencies. Within the pan-European region, there is the Ukraine-Russia war, but there's also Israel-Gaza. There are other emergencies as well. So, of course, it's a challenge on everyone. I am advocating for what I call a dual-track response. We are living in a perma-crisis. It means we're going to have this crisis globally, unfortunately, most likely for a while. So what needs to be done is the health system on one track to tackle the emergency and prepare better for other ones. At the second parallel track to provide daily essential healthcare. And the best way to combine those two tracks is through a strong community-based primary healthcare system to bring the care close to where the people live and thrive.